Hello, my name is John Rochford, and today I'd like to talk about 3 things to consider when choosing a dental implant system for your practice. The first thing to consider, and we often do with making any buying decision, is the price. Well, what's in a price? There's the price of what things cost, and then there's the value. The 2 types of systems that I wanted to focus on today are the premium systems and the value systems within the implant world. What's the difference between a premium implant system and what's the difference between a value implant system is typically the price. But there's advantages and disadvantages to both systems. With a premium system, you typically get a lot of options surgically, a lot of options restoratively. With a value system, you typically get a nice straightforward implant system surgically and restoratively. The advantage of having a lot of options is exactly that, having options. If something doesn't go as according to plan as you thought it would, you've got some backups or some bailouts that you can rely on. The disadvantage of having a straightforward or a simpler system could be the lack of options if something were to go sideways and you needed to make a change or a course correction. But both systems bring a lot to the table these days. There's not a big differentiation when it comes to the actual implant, but there can be a lot of difference when it comes to the restorative options. So that's something to consider when you're thinking about what to pay for and why. The second area to consider when making a decision on which implant system to choose for your practice would be the performance. Is there a difference in performance? A lot of people believe that all implants are the same. So why would you choose one system over the other? Well, there's a lot of things that could go into that decision. One question could be, what's the surgical kit like? Is it an intuitive, straightforward surgical kit to use, or is it too complicated? 2, what about integration times? Does one implant integrate faster than the other? Is there better bone maintenance with one implant system, or is there better tissue response with a certain implant system? Another key factor when making the decision when it comes to performance is maybe talk to a dental lab, get their opinion on which implant systems they like to restore or what they see the most of, if there's one system that has a lot of problems or one system that's the easiest to work with. And then lastly, if you're a specialist, you'd probably want to ask some of your referring doctors, is there a specific system that they like to restore or they like to work with? So once again, performance could mean a lot of things to a lot of people. That's why you probably want to rely on your opinion or your due diligence, maybe ask a dental lab, and then also ask a referring doctor if you're a specialist. The last area to consider when selecting an implant system for your practice would be the prestige. By prestige, I mean, how long has this system been around, or how long has this company been in business? What's the company history and what are they known for? Have they brought any innovations to the dental implant market in recent years, or are they currently working on something? And then, are you willing to stake your reputation on this particular system? And lastly, I think what's important is if a patient were to ask you, what system do you use and why? Are you comfortable explaining to them why you chose the system you chose? So in conclusion, the 3 things that I would consider when selecting an implant system for your practice would be the price, the performance, and the prestige. I look forward to hearing your comments and getting your opinions. My contact information is listed below. Thank you and take care.